Okay, thanks very much, Tracy, and thanks very much to the organisers for the invitation to speak today. We've been asked to prepare a case study on a knowledge brokering piece of work. My talk today is going to focus on a particular event which sought to establish engagement between research and policy on the topic of young people and drug and alcohol use. This is the event, and it was held in Trinity College, and it was organised with the Irish Universities Association. It used a methodology that was devised by the IUA to receive training from the European Commission's Research Centre, and worked very closely with Kate Morris in the IUA and Mr. Gage. I'm going to give you some brief background to our own work in the HRB's Evidence Centre to put this in context. But mainly what I want to do is explain the reasons why we decided to organise the event, its methodology and organisation, and the outcomes. What we learned about trying to integrate evidence into policy through an event like this. So, I work in the HRB's Evidence Centre, where I manage drug and alcohol research. The HRB is part of a network of focal points throughout Europe that provides information on drugs according to agreed standards. And it's coordinated by a European Commission agency called the EU Drugs Agency. We also manage the research and monitoring aspects of drug and alcohol strategies. So this means that the policymakers in drugs are aware of and depend on the data that we manage and provide to them. So there's been a strong culture of a supportive and evidence literate policy, and a trust in our capacity to provide scientific evidence. Our colleagues in the HRB Evidence Centre undertake a number of reviews each year for all units in the Department of Health. So we work in a strongly policy-aware environment. So this respect for our work and interest in evidence on behalf of the policymakers that we do work with has enabled us to be quite innovative in the space and develop dissemination tools such as the National Drugs Library, which has over 25,000 items in its collection, and DrugNet Ireland, our Research and Quality Quarterly, and the National Drugs Forum, which is an annual conference of stakeholders. This is not to say that we don't have obstacles like anybody who works in evidence research. But we have enjoyed the benefit of autonomy and a respected voice, a trusted voice in this area. And that's helped us in knowledge brokering work. So when we think about knowledge brokering, and there has been, I think, quite a lot today. We've heard a lot about it. We know there is a great deal of work being done in knowledge brokering, but it's also fair to say that these activities don't yet constitute an evidence base or a theoretical base on which to break base and it's broken in practice. And it's coming, but it's not like in health or social care. We're very clear about the theories that work and the practices work. Some writers in this topic are critical of the assumption that policymakers are reluctant to hear evidence, and this very much accords with their own experience. If we go back to John this morning spoke about a good client, and that's been our experience with people in policy. They're interested in evidence and take the time to hear evidence. So the image of the decision maker with no time or interest in science is somewhat of a caricature, but it still does inform a lot of practice in this area, according to a lot of the literature. There are approaches that are based on an assumption of curiosity and interest on the part of policymakers and a willingness to take time to learn. One of these is fostering research policy engagement, and that's practiced widely, at least in the UK and the US. The project I'm going to describe today fits in the category of building professional practice, and it's within that suite of activities. And there is some evidence of effectiveness in this area. So, as I was saying, this is the event, and I think Fergal referred to it earlier in his talk. It was organised with the Irish Universities Association, and they developed the whole methodology around the event. They had organised a similar event with the Department of Children earlier that year. Now, getting decision makers and research people in the same place is challenging, but the IUA had worked out a very effective approach and one that suited our need to build strength in the research and policy collaboration. The IUA's experience and contacts with both the higher education sector and policy were, I think, essential to this event. As part of their work in linking research in universities with decision makers in government, they worked very closely with 3 former heads of government departments, 2 of whom took up roles as senior policy fellows in universities. So there a great deal of knowledge and authority and a strong connection with the university sector. And this made the IUA a really strong partner in this project and helped us to attract interest from senior civil servants and research administrators and scientists and universities. So we discussed the theme for the event from a number of perspectives. Children and young people, of course, is a broad policy issue and relevant to a number of government departments and state agencies, and of course the European Commission, universities and non-governmental organisations. So there was a pragmatic reason for doing this. Drugs is one of those classic cross-cutting policy areas, but we always find that drugs policy is located in one ministry or department, whether it be the Department of Health, or Home Affairs, our interior ministries in the countries. What we're trying to do is to provide an overview of drugs and drugs policy to other policy areas that might not have known it as well as health policy makers. We felt it was important that policymakers, whose primary focus might not have been drugs, could get a sense of the evolution in thinking around drugs and the increasing emphasis on preparedness and rapid response as novel drugs emerge and new threats need to be identified. The broad idea of identifying potential threats and taking action in the present to prepare for them and prevent future harms was both an appealing idea in a broad policy sense and suited our agenda in shifting the focus to longer term concerns. About 90 people attended the event with senior civil servants from 8 government departments and other agencies, including TUSLA and the HSE, almost all universities and research funding bodies, including SFI, as was called at the time, and HRB. So it was quite successful in that sense, in the breadth of attendance from policy and academia. And I think the partnership with the IUA and the status of the research fellows involved really helped to persuade these busy people to attend. The format of the event, we had a number of plenary talks, and they set the scene of the government's research strategy, and that enabled us to see how our small field fit into that. Following the plenary session, there were 3 brokerage sessions, and each of them began with a policy challenge posed by a senior civil servant and a response from an academic who was working on a particular aspect of substance use. So that was the core of the IUA's method, the policy challenge, a response from researchers, and then discussion. So the first session was about trying to support future thinking. The policy challenge here came from the scientific director of one of the units in JJ Home in the European Commission and an expert in strategic foresight. And both were visitors to Dublin and brought an interesting perspective to our discussion. The research response came from the clinical lead in addiction services in the HSE, who played an important role in building monitoring capacity around emerging drugs, and from the head of student health in UCC, who led a recent prevalence study on drug use among third-level students and the development of an app to support prevention among students. There were no easy answers, but there was an opportunity to present quite new and challenging concepts to policymakers, and at least begin an understanding of how research could support an effective response in a fast-changing drugs environment, and practically how this might be supported through international collaboration and European funding. Our second brochure session had 2 policy challenges, one from a civil servant in the Department of Children who had an interest in measuring the impact of early intervention and prevention, and the Department of Justice civil servant who was concerned with the diversion of young people from criminal activity. The research response was from the leader of an innovative research project that used social network analysis to study initiation of children into crime gangs, and from the researchers who'd worked on the HRB funded analysis of drug and alcohol data in the Growing Up in Ireland survey. The third session focused on how best to construct evidence to support in shaping policy and operational activity. The policy challenges were presented by the leader in drugs policy in the Department of Health and the Department of Justice's head of information and analytics. So both the distilled presentation of policy issues and a reflection of the technical requirements to respond to the proper use of data. The research response was from a criminologist and a researcher who was also a champion of recovery. We had a science writer at the event and a note taker at each of the brokering sessions, so we had a very good record of the event. Among the common themes that came through the event were a recognition that civil servants and academics do work well together, and an infrastructure that enables the building of trust and understanding well-held policy development. So events like this are useful in themselves. And valuable data are available and need to be used better and linked to informed decision-making. The awareness of the data that are available would not have been universal across the policy side of the attendees. So we can definitely point to something that was learned and I'm in informed thinking. There was some discussion on the mechanism of research funding and the need to say research in this area in the broader context of the national research agenda. Having people from so many different backgrounds, policy backgrounds, arrive at this conclusion was encouraging. Also consistent across all these topics was an emphasis on the future and thinking about possibilities, both threats and opportunities, and how these colour decisions in the present. This isn't developed foresight or futures thinking yet, but it does show an openness to anticipation and imagining, and not simply extrapolating from the current situation. And recommendations aligned with these common themes, with the idea of developing linkages between policy and academia through a research network being one of the most prominent. The changing nature of drug use, particularly in regard to stimulant use and polydrug use, was clearly recognised, and the importance of readiness for emerging threats was stressed. And using existing data was tied to the research network idea. So the outcome of the event, the knowledge bridging event added momentum to a proposal that we had begun to discuss in the HRB beforehand, and it was taken up by both research and policy speakers. This was the idea of a research network, similar in approach to other networks that the HRB supported in mental health and inclusion health through its award system. So after this event, the HRB requested additional funding to its National Drug Strategy budget to create a research network in addiction studies. Earlier this year, and following a competitive process, the HRB commissioned the discipline of population medicine and public health in Trinity College to actually manage this network. So the Department of Health has increased its support for prevention work in recent years, and this event helps to emphasise the importance of prevention and how it had been somewhat neglected in current and previous drug strategies. Earlier this year, the HRB commissioned a review of prevention interventions in Ireland, which will serve as a baseline for the new drug strategy. So this was the direction that the department was going in. But we think that this event helped us strengthen our case to pursue the study. It was a once-off event, and I think I'd see it as complementing other knowledge brokering work that we do. And it's difficult to isolate the impact of works such as this, or say for sure, have led to later developments. But I would say that having such a wide range of policy and research people in the same place was worthwhile in itself. And it certainly helped to raise the issue of substance use among policymakers for whom it might not have been a primary concern. Thank you.